This semester, I've been researching a medical condition that affects postpartum women called postpartum thyroiditis. So the thyroid gland is an organ in the neck. It produces something called thyroid hormone, and pretty much what this hormone and what this organ do is they just control how fast cells in the body work. So it really affects everything from the heart, the intestines. So if you have a lot of thyroid hormone, your heart and your intestines are going to work super, super fast. If you don't have enough thyroid hormone, the cells in your body aren't going to work as fast. So you'll have a slower heart rate, or it'll take you longer to get stuff through your intestines. So that is a really simplified version of what the thyroid does. But in thyroiditis, the immune system is somehow triggered to attack the thyroid gland, usually just as an immune response to the delivery process. We don't really know a lot of how it gets triggered or a lot of the etiology behind it, but somehow the immune system starts attacking the thyroid gland. So at first, there is a huge increase in thyroid hormone as the cells are destroyed and the thyroid hormone is released into the body. But then after a few weeks, then there isn't enough thyroid hormone because the thyroid hormone is damaged and can't produce it anymore. So there's first an increase from the cells being destroyed and just releasing all of the thyroid hormone that's been trapped in them, and then a decrease because the cells are damaged and can't produce enough thyroid hormone to support the body's needs. The symptoms, they vary based on what stage you're at. So if you're in the hyperthyroidism, or a really high thyroid hormone stage in the beginning, you can have heart palpitations, exhaustion, heat intolerance, sweating, and nervousness. And then later, once you have past that high wave of thyroid hormone and a mom is at a point where her thyroid hormone just isn't functioning anymore, they can have constipation, weight gain, a slow heart rate, and feeling cold. And sadly, postpartum thyroiditis is also associated with postpartum depression. So it can affect the baby, unfortunately. So the autoantibodies, the things that trigger the body to attack the thyroid gland, can cross the placenta and they can cross breast milk entering the infant. So this can cause the infant's immune system to attack their thyroid gland. So that's called newborn hyperthyroidism, where the newborn's thyroid is getting attacked. So that can cause a lot of complications like decreased growth or even mental development. So it's really important that that is monitored and that parents are aware of this if they have it. So all women who can become pregnant, are pregnant, or are breastfeeding should take 160 micrograms of iodine daily. So thyroid hormone is made from iodine, and taking it will decrease a woman's risk of low thyroid hormone because they have the iodine that they need to make it. So it's really important to take iodine just to decrease the risk of having low thyroid hormone. Not all prenatal vitamins contain iodine, so it's really important to check the prenatal vitamin or just multivitamin that a woman is taking to make sure that it does have iodine in it. And lastly, if anyone thinks that they have postpartum thyroiditis, they should definitely just talk with their provider. It is 1 in 10 postpartum women are diagnosed with postpartum thyroiditis, according to this systemic review that I was studying. So it is fairly common. 1 in 10 women have been diagnosed with it postpartum. So thyroid levels can just be tested really quickly just with a blood test. So if you're ever worried about it, if anyone you know is ever worried about it, just have them talk to their provider and they'll order a quick thyroid test. In order to treat it, it usually just involves treating the symptoms more than anything. If they have really low thyroid hormone, they may be placed on something called levothyroxine. That's a replacement for thyroid hormone. But other than that, usually the treatment is just treating the symptoms that are most bothering to the patient. So lastly, even if thyroid levels are normal, it is really important to just continue talking with a provider, because even if someone doesn't have postpartum thyroiditis, unfortunately the symptoms of just being a postpartum woman are pretty similar to postpartum thyroiditis, like the exhaustion, the weight gain, the weight loss, the feeling fatigued. Like that's a very normal part of being postpartum. So even if thyroid levels are normal, it's really important that postpartum women just keep talking to their doctor about the symptoms that they're experiencing and ways to correct those so that they can still function in their life the way that they would like to and live their life the way they'd like to, and still be happy and have resources as they're adjusting to the new period of being a mom and living the postpartum life. So most of the resources that I was looking at more have to do with just supporting the postpartum lifestyle, especially since I said postpartum thyroiditis has a link to postpartum depression. So most of the resources that I was collecting are more just postpartum support in general, but here are some YouTube and Instagram links. Some of them are specific to hypothyroidism and the thyroid, so I put like the American Thyroid Association's Instagram on here. Mama Dr. Jones is a gynecologist that I love. I also put free dietary counseling on there through WIC, through the Utah Health Department, and that's really important just to support postpartum moms in general, but especially postpartum moms with postpartum thyroiditis, so that way they can get all the nutrients that they're needing in their food. There's also some free parenting classes that I found through the health department as well, and so the link to those are on there. And then lastly, I just found a lot of support groups that are free as well, and here are a few that I found in our area, and these are just really important because, as I've said multiple times, postpartum thyroiditis is linked to postpartum depression, and so having support groups of other moms that are going through similar things, maybe even postpartum thyroiditis as well, is so therapeutic and very helpful, so I put a bunch of those on there. And lastly, these are my resources. I really think that this needs to be talked about more because in my experience, I haven't heard about it very much except in my health classes and as I'm researching this, and it surprised me how common it is that it is 1 in 10 women that are diagnosed with this, but we're not talking about it and we're not making women aware of how the things that they're feeling, whether that's fatigue or weight gain or heart palpitations, all of the difficult things that they could be dealing with postpartum could be linked to a thyroid hormone dysfunction, and so it's really important that they can get their thyroid levels tested and get treated if possible. So anyways, that was my presentation. Hope you enjoyed it. Thank you.